country is still adjusting to the national lockdown extension, and this means social isolation from friends and family, hygiene reminders, children learning at home, and financially uncertain times. So the fears of another extension can increase anxiety. Director of Decolonial Mental Health, Zolani Metu, joining us this morning to help us navigate the next couple of weeks. Zolani, a very good morning to you. And yes, we are coming to the end of what would have been the of week 3, the end of our original lockdown, but we know we have 2 more weeks to go after that. How does one mentally prepare, especially for those who might be thinking, life would have gone back to normal maybe from Friday or Saturday, and then now to just look ahead past the next 2 weeks after that?
Sure. A very good morning to you and a good morning to your viewers at home. I think it is a difficult time, quite a challenging time, and I think one understands the sort of the rationale behind the extension and why it's important. But I think looking at sort of the psychosocial implications of the lockdown, I think there are a number of issues that we can look at, right? The sort of pre-existing conditions that some people have. So people who may be living with a mental health condition, this may be quite a difficult time for them. It's also, an emergency, and so there is emergency-induced anxieties, grief. There may be acute stress here and there. And so these are realities that, we can look at. But also there's a sense of anxiety that may be induced by the responses of the government, right? So a response-based sort of anxiety where people are perhaps wondering, how do I get access to food parcels that are being passed on? Some people are unhappy with the sort of response. And so there are those difficult issues that people are currently navigating. But I suppose also, one of the realities that we also need to be quite appreciative of is that, South Africa's public health care system is quite good in terms of maximizing access. And so what that means is people living with mental illnesses and people with pre-existing conditions that were there before the lockdown and, the outbreak of the coronavirus, do have the platform to seek the necessary care that they need. And that's a protective factor on its own, because the very fact that people know the conditions that they're living with means that they know what steps they need to take. And some people would have gotten psychotherapy, which means they've learned some coping mechanisms through that. But moving to, people who don't necessarily know what predispositions they have as far as mental health is concerned, that's where the risk is, right? And very often people tend to struggle to see signs and symptoms. And this is a difficult period where, people are struggling with their eating habits. People's sleeping is compromised, and there's disordered sleeping. And so those are some of the realities that we're dealing with.
And I think also, when a lot of people, when it comes to mental health issues, Zolani, a lot of them actually depend on getting physical, getting exercise, getting out there to actually cope with these conditions as well. And that will be proving a little bit more of a challenge, trying to stretch this now past the initial 3 weeks of lockdown.
Absolutely. I mean, I think, the spatial limitations that are there now make it difficult for people to just go for jogging, etc. But I mean, there are a number of ways in which you can try and, exercise within your home environment. And of course, often these recommendations don't necessarily take into account situations of people who are living in a shack and there are about 6 people in one shack. That makes it quite difficult for you to say you can even create space to exercise, etc. But I think the encouragement here is that people should seek some form of physical activity, be it that you are doing a guara, a vosho in the house. The idea is to act, to try and be as active as you possibly can. And I think also another issue that we've kind of been ignoring in this time is that being home indoors does mean that, if you don't have proper ventilation in your house, you run the risk of getting headaches. I've had a number of people saying, I've been getting headaches and I don't know where they're coming from. And a simple thing as such as waking up, opening up your windows, ensuring that there's there's the necessary ventilation in your house makes all the difference, and just making sure that your body has sufficient intake of oxygen.
Just those little things to get the endorphins up. Thanks very much there. That's Zolani Mehta, Director of Decolonial Mental Health, just helping us.